Whether or not someone chooses to get genetic screening done in the pregnancy or genetic testing done in the pregnancy can be a daunting decision. The terminology can be confusing. Heck, it was for me when I started. So let's simplify it and go through it step by step, as well as some of the common questions and scenarios surrounding genetic screening and genetic testing in pregnancy. Let's get started. My name is Eric Schmidt. I'm a board-certified OBGYN, and this is a series called Dude Expecting. We're looking to give all partners information and tools they need to be the supportive loved one they want to be. And really, this video is for everyone. So why do we do genetic screening, you might ask? Well, what we want to do is find out to see if there's an increased chance or decreased chance of a pregnancy potentially having chromosomal or other abnormalities. These chromosomal abnormalities can happen in a number of ways. There can be extra chromosomes, there can be missing chromosomes, there can be microdeletions, there can be duplications, translocations, whole bunch of things. And these can all have a wide range of effects. In this talk, we'll probably reference trisomy 21 or Down syndrome a lot because that's one of the most well-known. It's also one of the most common chromosomal abnormalities with an extra chromosome on chromosome number 21. For example, if someone is 20 years old, their chances of producing Down syndrome or trisomy 21 is about 1 in 1,250. Contrasting that with someone who is approximately 40 years old, their chances are about 1 in 86. So it's quite a difference. A big question is, does someone have to get genetic screening done? And the answer is no, you don't. This is completely 100% your option. To go back to that example of the 20-year-old versus the 40-year-old, there might be a difference in recommendation for whether or not someone should get genetic screening done, but it is always still your option. So first off, what is genetic screening? Well, it's very important to differentiate between the two terms, genetic screening and genetic testing. Genetic screening is often what people are referring to in this scenario. Genetic screening is a non-invasive option. There's multiple different options you can choose from, but it really is telling you, is there an increased risk or not? It's not a for sure yes or no answer that you're getting from this genetic screening. That for sure yes or no answer generally comes from the genetic testing, which we'll talk about more in the second half of the video. Okay, let's talk about genetic screening options. The first one we'll talk about is the new kid on the block. This is the cell-free DNA. You might see this abbreviated as NIPT. Also, there are certain brand names like Maternity 21, et cetera, et cetera. Now, the cell-free DNA is a maternal blood draw that is done often at the first prenatal visit or the next visit as soon as someone is 9 to 10 weeks in the pregnancy, because you do have to be that far along to get this test done. However, after that point in time, you can do it at any point in the pregnancy. What this test does through that maternal blood draw is it picks up fetal fractions of the DNA, puts them together, and is able to come up with that very good assessment of, are you at increased risk or not for these certain chromosome or genetic abnormalities. Now, this test probably is most well known for the fact that it gives you fetal sex or gender of your baby if you want to know that, but you can also choose not to know that, and we can just click a certain button and it might hide that information, so you can find it out whenever you want. This test is nice because it has the highest detection rate for certain chromosome abnormalities like trisomy 21, which is 99%. It also has a very low false positive rate, which is also very good. The advantages of this test is it can identify a number of different potential abnormalities or chromosomal abnormalities or variations more than any of the other screening tests that we'll talk about later on. It can also detect a group of variations called sex chromosome abnormalities. This would be like Klinefelter's or Turner's syndrome, which the other tests do not pick up. The disadvantages of this test is that it was really only initially for moms that were deemed higher risk, maybe had a history of chromosome abnormalities, maybe age over 35. However, this is widely available to any mom, any age or risk factors or not. Now, what you might have to worry about with this cell-free DNA test, especially if you don't fall under the high-risk categories, is that maybe there could be some out-of-pocket cost. Now, each insurance is different and each test is a little bit different in how it's covered. And so you might just have to check with your providers to see, what are the chances this might be out of pocket. For example, the company that we use, if insurance doesn't completely cover it, they guarantee they would only charge a patient, let's say $200 to $300 at the most. And the last little minor disadvantage is that this genetic screening option doesn't include an ultrasound. Now, often patients are getting an ultrasound already before this to confirm their gestational age, but the first trimester screening, which is the next option, is both a maternal blood test and also an ultrasound. This first trimester screening option has been the long-standing gold standard of prenatal genetic screening early on in a pregnancy. This can be done anywhere from 10 to just before 14 weeks of pregnancy. It has a very good detection rate, however not as high as the cell-free DNA. Its detection rate is approximately 87 to 90%. So the blood test part of this test looks at certain protein levels in mom's body that can be, if elevated, potentially associated with abnormalities. It also includes that ultrasound, which looks at the thickness behind baby's neck. That's called the nuchal translucency. If that is thickened greater than the 99th percentile for the given gestational age that someone's getting this test, that would put you at potential increased risk of that pregnancy having a chromosomal abnormality. Now, briefly, the second trimester screening option is the next option we'll talk about. It is just a blood test that is done approximately 15 to 22 weeks of the pregnancy. And again, is a good test to be done. We're generally doing this if patients are maybe a little bit later to their care and therefore they miss the first trimester testing and they don't want to have to do the cell-free DNA testing. The detection risk for trisomy 21 in this test would be about 81%. There can also be slight variations, combinations of the last two options that we talked about that maybe your practice that you go to performs these. Okay, so we just wrapped up genetic screening options. Let's now briefly overview genetic testing options. Now, these are the invasive options. And why someone would do this test? Well, this is the test that's going to give you the for sure yes, no option for looking for genetic abnormalities or chromosomal abnormalities. There's really two big tests, and it really depends on when you are in the pregnancy for which option you're going to have. If someone very early on wants to get the best assessment or genetic testing option, the first option would be CVS, or chorionic villi sampling. This is an ultrasound guided either transcervical or transabdominal sampling of those early placental cells, and this is often done around 10 to 13 weeks of gestation. Now, this definitely is more invasive of an option than the previous screening options that we talked about. However, procedure-related pregnancy loss, luckily, and with bettering technology and techniques, is only about 1 in every 450 plus procedures. The second option that someone might have for genetic testing would be amniocentesis. This is done a little later on in the pregnancy than CVS. This is done at 15 plus weeks of the pregnancy. This amniocentesis test is done transabdominally. And so with the long needle, the amniotic fluid is sampled and then sent for testing. Rightfully so, someone would generally be very apprehensive about these tests, but luckily, again, they have a very low risk rate and a very low pregnancy loss rate in 1 to 700 or 900 procedures. I want to briefly talk about carrier screening because this might be confused a little bit with these two options that we just talked about. Carrier screening is actually when the parents test their own genetics to see if they carry any potential genes that they might not overtly have symptoms of, or they might not phenotypically show symptoms of. They had a partner that also had a gene like that. Combined together could put the baby at potentially higher chance of developing certain diseases. Now, this could be something like cystic fibrosis, sickle cell anemia. And so I think personally that all adults should get themselves tested for these certain genes or traits that they might have. The next question we'll answer is, well, what if I have a positive test on my genetic screening? What to do now? So again, the genetic screening options are not the for sure yes or no option. And so if someone has a positive genetic screening option, we generally recommend, if they want further answers and a for sure yes or no, the genetic testing option. That would be the CVS or the amniocentesis. Now, actually in clinical practice, if someone does the first trimester screening or someone does the second trimester screening, we actually probably would do the cell-free DNA just to confirm whether or not that comes at positive, because it has a higher detection rate and a lower false positive rate. So let's talk quickly about cost, because that's often a question we get. We talked about the cost potential implications with the cell-free DNA and that it's a newer test, and so insurances aren't all the way there for paying for it universally. So there could be potential cost if someone does the cell-free DNA. You have to check with your provider and the testing company to see what your out-of-pocket may potentially be. When it comes to the first and second trimester screening options, again, depends a lot on insurance. And so you want to double check with that. Again, these are the gold standard options. And so generally they would be likely covered by your insurance, but always safe to double check. And I think there's a good point to also clarify with genetic screening options is that, let's say there's a positive test. The patient might say, well, you know what? I wouldn't do anything about that positive test result anyway, so why should I get the test done? And again, to clarify, if they say, oh, they wouldn't do anything, they wouldn't consider things like pregnancy termination if they did have their positive test. Now, again, it's 100% your option whether or not you want genetic testing or screening done in your pregnancy. But the more information we have, if a baby did potentially have chromosomal abnormalities or other abnormalities, we might want to monitor that pregnancy closer because we know that maybe a pregnancy with trisomy 21 or Down syndrome may have an increased risk of cardiac abnormalities. And so we might want to take a closer look at baby's heart with a 20-week ultrasound and maybe even a fetal echocardiogram a few weeks after that. And so, for us, we like more information, but for a patient, if they're not that type of person, then again, it's always your option. Okay, so let's go over some brief scenarios which I commonly see and which scenario might be best fit for that person. If someone wants the most information possible, well, really, you'd have to do genetic testing because again, that's the only for sure yes/no option. A close second behind that is if you're someone that, again, wants to know all the information possible, likely that person's going to do the cell-free DNA or the NIPT screening option. If someone for some reason presents later in their pregnancy and they might not have the option of the first trimester screening, they might not have the option of the second trimester screening. And so often at that point, if they wanted a screening option, it would again be the cell-free DNA. If someone wanted the option that might include an additional ultrasound, well, that would be the first trimester screening. If someone wants a good option and doesn't want any out of pocket, this would likely be the first trimester screening or the second trimester screening. If someone does have a personal history of any genetic variations, chromosomal abnormalities, or a prior pregnancy that was affected by this, often we're recommending the cell-free DNA or the invasive testing options such as the CVS or the amniocentesis. And once again, this is all a very patient-dependent, very shared decision-making process with your provider on which option you want or any of the options at all. All right, everyone, thank you again for joining us for another episode of Dude Expecting. If you watched until now, please give us a like and subscribe. I hope you learned something. If you have any questions about it or anything that I talked about that wasn't exactly clear, leave a comment below. We'll answer it or maybe even have a follow-up video. Have a good rest of your day, everybody. We'll see you later. Different tests which might be integrated, combined, or subsequential.